About what you do.
Sure.
Your specialty. She has a fellowship, so tell them about your
Yeah, I did. I actually, after I started working, after a few years, I went back to fellowship. It sort of started in our office, and then it kind of grew for me, which is like the heartburn and swallowing disorders issues. So the thing about that area of treatment is that you have to be able to do the functional and chemical workup and diagnostics in order to identify people who are appropriate for anti-reflux surgery. Heartburn is super common, right? Everyone can relate to having heartburn or feeling like your food gets stuck a little bit sometimes, right? So for all of us, it's a sometimes thing, and for some of us, it's an all the time thing, and that's not normal. And so what happened for me is when I started working, I started to realize that we would take care of the gallbladder, and we would take care of the this and that, and then there was always this thing remaining. Oh, but I don't feel good, I'm bloated, I'm always having pain, my pills get stuck, and after a while I started to realize, like, largely reflux patients, pathologic reflux patients, and how I like to explain is like when your heartburn turns into a disease and not a casual annoyance. And that's actually super common. I realized that through working, is that it's super common. And the more I learned about it, the more I realized that field actually has been, as technology has caught up, and medical diagnostics has caught up, that field has really blown up quite a lot and gone really deep, especially into surgical endoscopy and more advanced diagnostic technique. So it made me realize I'm not going to teach it to myself. I'm going to have to go back to school and learn it properly if I want to really focus on it. And so that's the reason I went to fellowship. And now we've upgraded our system. So we do esophageal manometry, which is the swallowing evaluation, and pH testing in the office. And then with our center, we're able to do the endoscopy in the office, basically. And it lets us quickly identify and get people from complaints of chest pain and heartburn to anti-reflux surgery when it's appropriate very quickly. We're hard pressed to find people that do it, that focus on it.